Welcome to Thursday's edition of COVID-19. Our daily tally is holding steady on the 600 level as inoculations continue in earnest, with Janssen vaccines being rolled out today by courtesy, that is, of the US. And we have more on that campaign later on the program. Here first is the broader pandemic coverage. Now, so what is the latest here in Korea for this Thursday?
Sunny, Korea posted a slight uptick in infections this Thursday with 611 cases reported as of 12 a.m. And with that, the number of domestic transmissions has also risen to close to 600. If we take a look at our graph now, we've been in the 600s for the past 2 days after having 400s recently. But if we compare the figure to last Thursday, we are seeing an on-week decline. And taking a look at our map now, we've got a rise in the capital Seoul to the 200s, followed by 180 cases in Gyeonggi-do province, and also many other places that are seeing double-digit figures even down in Jeju-do Island, while the administrative city of Sejong with 3 new cases has hit 500 infections in total this Thursday. And with that, Korea has a total number of 146,303 COVID-19 infections.
Right. Meanwhile, so on the vaccination front, I hear we've marked a milestone on this Thursday.
Yes, Sunny, as health authorities have been anticipating, the 10 million mark has been hit this Thursday as of 11 a.m. That's roughly 19.6% of the nation's population. And that milestone has been reached in 105 days since Korea's COVID-19 vaccination program has kicked off in late February. And the numbers that we are seeing here, however, are the numbers of inoculations done on Wednesday. So that's why this number currently stands at 9.79 million. And we are expecting the vaccination process to pick up further speed with a new group of people starting to receive their jabs this Thursday and also with a new vaccine. Military-affiliated people aged between 30 and 60, including reserve forces and civil defense members, are being administered with the U.S.-made and U.S.-provided Johnson & Johnson Janssen vaccine. A little over 1 million doses were recently shipped, which means the same number of people will be able to get fully vaccinated with the product, which only requires a single dose. Roughly 234,000 people are expected to receive their shots on the first day. Janssen inoculations for pre-registered applicants are to be completed on June 20th. Meanwhile, surplus vaccines will be prioritized for seniors aged 60 and above. And let's shift our focus now abroad and to a number of countries that are seeing their highest figures in the months. Now, first off, Russia's Wednesday caseload topped 10,000 for the first time in more than 3 months, with over 4,100 infections in Moscow alone, and that was the highest there since mid-January. And then Indonesia and the UK here have seen their highest figures since the end of February at 7,700 in Indonesia and more than 7,500 in the UK. So let's also take a closer look at the accumulated number of infections in these countries. Here, Russia with 5.1 million cases in total, the country with the 6th highest caseload in the world, followed by the UK at 4.5 million. And here, Indonesia now has more than 1.87 million cases in total. And the total number of infections around the world stands at 175.1 million, with a rise in daily cases as well as daily fatalities at over 14,000 deaths reported in the span of 24 hours. And those are the updates I have for now, but I'll see you back after the government briefing. Sunny?
All right, so thank you for now. Right, travel for leisure is looking to be a reality this summer, minus the hassle of self-isolation, provided the traveller has been vaccinated. For more on this, I have our Kim Do-yeon here in the studio with me. Welcome, Do-yeon.
Good afternoon, Sunny.
Right, so the gist here in the country is to seek travel bubbles with some of its neighbours.
Right, if realized, the travel bubble will make group traveling possible again between Korea and several other countries, so as long as they have a bilateral agreement. With a negative PCR test result and a vaccine certificate, people can travel to countries within the bubble, and they will not be subject to quarantine if they test negative for COVID-19 upon returning. Korea is currently negotiating a travel bubble with Singapore, Taiwan, and Thailand, among other countries. Looking more broadly, Hong Kong, Singapore, Australia, New Zealand, Taiwan, and Palau have already or are planning to implement such a system. Health authorities believe this is an important first step in reviving the travel industry.
Broader exchanges with other countries through a travel bubble will provide more convenience for citizens, aid the recovery of the tourism and aviation industries, while effectively containing the spread of imported cases.
Now, I'm sure industry players are probably applauding this latest travel initiative.
Right, so I spoke to a representative earlier in Korea today, and he sounded very excited. He said the company already has overseas tour packages in the works right now. Take a listen.
We are certainly glad to see the government laying the groundwork for a resumption in travel. We've already created packages for countries where travel is possible, since they're reopening their borders one by one.
Right, and Torin, what has been the public response to this move?
Well, as of now, there aren't that many people who meet the full requirements to resume traveling. So even though ease restrictions are likely to come in effect starting July, we probably won't see a pickup in travel until about a month or so later.
We haven't seen any notable differences in the number of calls and inquiries coming in, since vaccinations are a requirement. We believe many people will have been fully vaccinated by September, so we're expecting an increase in travel to occur sometime in September or October.
I see. So in the later summer and early autumn. Meanwhile, what should travelers keep in mind when seeking to venture overseas?
Right. The usual exercise and prevention we can all now visualize because we've been living under COVID-19 for more than a year. But one thing to keep in mind is that travel will only be allowed in group tour packages. Vacationing solo is not an option for now to allow health authorities to better monitor the travelers and respond to any outbreaks. In addition, travelers will only be allowed to take direct flights between Korea and a partnering country. They're also required to have stayed in Korea for 2 weeks prior to their departure date. The same requirements apply vice versa to those coming to Korea from partnering countries.
Sounds quite promising. But Torin, I hear there is still much work ahead.
Right, for example, there's still no maximum number of people allowed per group. But when the rules are eventually set, the government is looking to better enforce them by assigning chaperones to make sure tour groups comply with local prevention guidelines. They may even delegate some authority to the tour guides leading groups. The government believes the sharing of responsibility may lead to better prevention.
Compliance to prevention guidelines will be the responsibility of not only individual travelers, but travel agencies as well, and we will strengthen our containment efforts through this double layer of accountability.
I see. Greater responsibility then. All right, Torin, thank you for that coverage.
Thank you.
Right, up next, we are poised to join the regular briefing on the COVID-19 situation here in Korea for this Thursday. Now, authorities have been highlighting the importance of ventilation in recent days as many opt for air-conditioned indoor venues to escape the heat. Now, be sure to allow for a regular circulation of fresh air to limit the risk of transmissions. Now, we're still waiting for the briefing to commence, so why don't we take a look at the incentives for those who have received at least one dose of the COVID-19 vaccine and have witnessed the passing of 2 weeks. First, these individuals are excluded from the cap of 8 people for family gatherings. This means any family member who has received at least one dose at least 2 weeks prior will be exempted from the head count of 8 people for family events. Secondly, access to senior welfare and activity centres is allowed for them, and for those fully vaccinated, recreational programs such as singing classes is permitted, as is the sharing of meals. Also, in-person visits to nursing homes is possible if one party is fully vaccinated. However, at nursing homes where the vaccination rate for the first dose stands at below 75%, a negative PCR test will also be required. Prior reservations are necessary and no eating nor drinking is allowed during these face-to-face meetings at nursing homes, and masks remain mandatory. Moreover, those fully vaccinated and working at high-risk facilities such as nursing homes will also be exempted from the regular mandatory screening requirement, which reportedly takes place at least once a week. Other incentives include entrance discounts or even fee waivers at concert halls and national parks. And come July, those who have received the first dose can go mask-free when outdoors. We are still waiting for the briefing to start, so let's now turn to the possible discomforts after COVID-19 vaccination. Common side effects include pain at the injection site, fatigue, and headaches. Now, with regard to ways to minimize discomfort, here are a few natural remedies. Try applying a cold cloth or pack on the injection site, or try gently moving your vaccinated arm to stimulate blood flow to disperse the local area of inflammation. For those suffering from fatigue, get some rest, while for fever, drink plenty of water. If you need to take a painkiller, doctors recommend medication that includes acetaminophen. And thirdly, should your discomfort worsen, be sure to dial 119 for guidance. The briefing is yet to begin, so here now are the social distancing guidelines in place until the 13th of June. That would be this coming Sunday. Level 2 measures for the Greater Seoul area as well as a few other regions, including Jeju Island. The rest of the country faces level 1.5 social distancing. The ban on gatherings remains in place, with 5 or more people not permitted to meet for social purposes, but with exceptions in a few places that have been recording fewer cases and for those who have received at least one dose of the COVID-19 vaccine. Also, businesses including movie theatres, internet cafes, video game arcades, cram schools, amusement parks, as well as retail stores face no limit on operation hours. Meanwhile, restaurants, cafes, indoor gyms, singing rooms, party venues and indoor standing concert places can be open until 10 p.m. under level 2. These venues, however, may see a 9 p.m. closing hour if the daily tally continues to climb. Also, nightlife entertainment establishments, including clubs and bars, have been shut. Movie theatres and performance halls have to leave one seat empty between patrons or parties. Sports stadiums under level 2 can host 10% of their capacity, while those under level 1.5 can host 30%. The attendance cap on weddings and funerals stands at 99 here in the metropolitan region and 499 in the rest of the nation. Places of worship are to abide by 20% capacity here in the metropolitan region for regular sermons and a 30% capacity elsewhere. Other religious activities such as Bible study, choir practice, meal sharing and lodging remain banned nationwide. Right, we're still waiting for that briefing to start, so perhaps now we can take a look at today's COVID-19 numbers for Korea. That would be for this Thursday. As Soa mentioned earlier, we have more than 600 new infections on this Thursday, raising our total to above 146,000. We lost 2 lives over the past 24 hours, raising our death toll to 1,979. Those in quarantine remain at above 7,000, while those fully recovered stands at above 136,000. The briefing I hear is where to start. We'll come back to you afterwards.
Let us now begin our regular briefing for June 10th. As of today, 11 a.m. today, the number of COVID-19 vaccine recipients have surpassed 10 million here in South Korea. And starting from today, we also begin the rollout of Janssen vaccines for the military-related personnel, including reserve forces and civil defense forces. And right now, we have about 16 million people who have been administered with at least one dose. And this is about 19.6% of the total population. This was all possible thanks to all of the participation put forth by the public, as well as many people working in the front lines and providing the vaccines to our citizens. And as for the vaccination rate and also the infectious rate by age group, we see those aged over the age of 75, we see a clear decline of the infections. And as for the seniors above the age of 75, we believe that this is the highest risk group, and they have been administered with the Pfizer vaccines, and about 74.4% of them have received at least one dose. And those above the age age of 65 and 74, we have about 60% of the vaccination rate, and we believe that after 2 weeks' time, we believe that these people will also have higher protection against the COVID-19. And we aim to inoculate about 13 million people by the first half of this year, which is about 25% of the total population. And we believe that after July, that is, we believe that and we expect the total number of infections to decline on a gradual basis. And the Janssen vaccines will be rolled out starting from today until the 16th of June. And the recipients are those who have already completed their booking process. And we have about 890,000 people who are military-related personnel, including the members of reserve forces and civil defense corps. And as for the surplus vaccines, you could also utilize the Naver or Cacao, and you could also reserve for and sign up for the surplus vaccines, just like the AstraZeneca vaccines. And we also designate those above the age of 30 who will be subject to the surplus vaccines of Janssen, and this is the same as the recipients of the AstraZeneca vaccines. And as for the AstraZeneca vaccines, we also have some risks or blood clot risks. And if you see any symptoms of related blood clots with low platelets after inoculation, please report to the doctors, and please also get treated. And we ask the doctors and medical professionals to also report these cases to the KDCA. And as for clinical symptoms, they include within the 4-week period after inoculation. The symptoms include hardness of breathing and swollenness, and also very severe headache that lasts over 2 days, and which does not subside even after taking painkillers, and also loss of eyesight as well. So if you have any symptoms that I've just mentioned, you need to immediately visit a doctor as soon as possible. And as for the people aged over the age of 60 and 74, we see that the vaccination booking rate has surpassed 80%. And we also see that at some regions and also at some hospitals, we could also see some people will be subject to the adjustment of the schedules for vaccination. However, with the utilization of our special LDS syringes, we will be making sure that these vaccines will be rolled out as effectively as possible to the senior citizens who are the primary recipients right now. And as for Janssen vaccines as well, if there are any surplus vaccines, they will also prioritized for those over the age of 60 under the premise that they have showed consent. And we also see that depending on their regional status, if there are also people who cannot show up to the vaccinations, we will make sure that they can be vaccinated within July. And also do not be anxious if you have to miss your pre-scheduled booking date. And we will also roll out these vaccines on a most effective way. And as for the social essential workers below the age of 30, we have some updates. And as for the social essential workers who are the Q2 eligible recipients, the booking process has been completed earlier than expected, and we believe that there have been many people who were not able to sign up for the vaccines. And going forward, we will also administer more drugs, more vaccines, that is, to these group of people. And we will also begin the vaccination booking process starting from the 5th of July. And the rolling out of the vaccines will begin on the 5th of July. And this means that in mid to late June, we will begin another process of receiving the booking for the appointments. So please please utilize this process if you are the eligible recipient. And starting also today, actor Kim Eung-soo has been named as the Goodwill Ambassador for vaccination. And this person will also be starred at commercials, campaigns, as well as posters in order to promote and encourage more people to get vaccinated. And we will also join this process. And once again, I would like to extend my deepest appreciation for your participation. And next, as for the vaccination rollout and the COVID-19 status and other major countries, globally, the weekly analysis and weekly daily tally has been on a decline for the past 5 weeks. However, in Latin America, including Brazil and Argentina, we are seeing continued increase in the number of daily tally. And we also see the weekly tally standing about 3 million, which is a slight decline from the previous week. And the 5 top nations with the highest numbers of tallies, and among them 3 countries are Latin American countries, including Brazil and Argentina, and they are also seeing a clear and consistent rise in the daily tally. We are also seeing rampant spread of new variants. In UK, the Alpha variant has now been swifting to the Delta variant, which has first identified in India, that is, and this is now becoming the dominant strain there. And this calls for our continued precaution here in South Korea as well. And in US, also Germany and Israel, which has a very high rate of vaccination rates, they are also easing and lifting of the mask wearing mandates at outdoors. However, they are still abiding by basic quarantine rules. So we ask the recipients of the vaccines here in South Korea to also do the same. And the next is not related to COVID-19. However, we have some hepatitis A occurrences increasing due to the consumption of mussels here in Korea, and centering around the metropolitan area, we are seeing more occurrences, and including the hepatitis A, and this also has been detected among the many gene samples here in South Korea. And these consumption of raw clams especially increases the risks of hepatitis A, and we ask you to fully cook the clams before you consume them. And because also we can protect these and prevent the occurrence with a vaccine, so we ask you to also receive the vaccination if you do not have antibodies yet. And as for today, we have surpassed 10 million. That is, as for the number of first dose recipients, we extend our deepest appreciation to all of the medical staff members. And in the first half this year, we are prioritizing the protection of lives and health of the senior citizens. And under this aim and purpose and target, we have many people working and also dedicating their time and energy to give out the vaccines. Of course, the vaccine distribution is requires high level of carefulness, and also we have seen these medical professionals also visiting the senior citizens in person to provide the vaccination as well. And there were many efforts behind the scenes as well in order to make this milestone possible. And at the vaccination centers, we also have many other people who are in charge of logistics, as well as who are related to the pharmacies. And also we believe that this was all possible due to your concerted efforts. So we would like to thank you once again. And lately we are seeing scorching heat right now. And however, there are many people who are also working at the screening centers who have to wear fully equipped gears. And we are very much concerned about their safety and health as well. So if you meet these epidemiological investigators or medical staff members who are exerting their full efforts, please provide them with words of encouragement. And above all, with the COVID-19 being a prolonged pandemic here in South Korea, we would like to once again thank the members of the public for exerting your solidarity and unity, and also participation in our continued social distancing measures and other quarantine measures. We will also exert our full efforts to this end. Thank you very much.
Right, there was Chong Young with Thursday's afternoon briefing, and I have our Kwon Soa back here in the studio with details on what she said.
Well, Chung highlighted the milestone of 10 million people who have been vaccinated with at least one dose of COVID-19 vaccine, and she thanked all the people that have been involved in the nation's vaccination program. She also expected the number of COVID-19 patients to decline around mid-July, and that's after around a quarter of people have been vaccinated by the end of this month. Chung also noted the possibility of a slight rescheduling in vaccinations over the high reservation of over 80% among seniors aged 60 to 74, saying that officials will do all they can to use the surplus vaccines as efficiently as possible.
I see. All right, so thank you very much for that.
My pleasure.
말 상반기 접종 목표 1,300만 명, 전 국민 25% 이상 접종은 조기에 달성될 것이며 중증 환자와 사망자 최소화에도 기여할 것으로 그렇게 기대하고 있습니다.
얀센 백신 100만 명분을 도입하면서 상반기에 1,400만 명 정도의 1차 접종이 종료가 될 수 있을 걸로 판단하고 있습니다.
Janssen vaccinations have been launched on this Thursday here in Korea using the supplies offered by the US following summit talks in late last month. Now, for more on inoculation efforts and on the current state of the pandemic, I have Professor Chung Gi-seok from Hallym University. Pleasure to have you with us, Professor Chung.
Thank you for inviting me.
And I also have Professor Kim Moon-gyu from Yonsei University. Good to see you again, Professor Kim.
Good afternoon.
Right, Professor Chung, we marked a milestone as of 11 a.m. on this Thursday here in Korea. 10 million people have received one dose of the COVID-19 vaccine. What are your prospects on our plans, or our hopes that is, to offer the first dose, or the one dose, to at least 13 million people within the first half of this year?
Yeah, I do believe that it will be going very well. I'm one of the person who've got the vaccination. But there are some minor issues to be arranged before that. First of all, the supply of vaccine and even the low dead space syringe is not very flexible, or there are some imbalance between supply and demand. So I hear quite a few doctors who are running private clinic that they are lacking vaccines and they are lacking low dead space syringe. And the other one is there are too much of a paperwork in putting the vaccination. Because if you work with the flu vaccine, there is not many paperwork. But these days, the government is requiring a lot of paperwork. So after finishing vaccination, the nurses and doctors have to work another extra few hours to complete those paperwork. So that kind of process need to be simplified if you like to get the 36 million people to be vaccinated until September or November. And the other one is the government has changed quite frequently the policy of getting a reservation and distributing vaccines. So that needs to be changed. And then we'll be going forward very smoothly to the end of herd immunity.
Hopefully the change will come in the near future.
Yeah.
Professor Kim, authorities, as Professor Chung mentioned, believe that 70% of Korea's population will be fully vaccinated within the third quarter. What do you believe will drive this momentum?
We must have a certain degree of herd immunity before Chuseok, and since the vaccine is not 100% working, I think we need more than 70% of our population getting vaccinated. And as there are emerging new variants every time, and that might cause some degree of cluster outbreaks, so that might put down some vaccine effectiveness. So if you look at the countries who was efficient in vaccination program, they usually reach to 40% of their population very easily. But after they reach 40%, there are some countries going on with that slope, but there are some countries declining in their slope. And I think UK is a country that had a decline in their slope, but Israel is a good sample. They give a incentive, so I think they reach quite a degree of vaccination right now. So they don't need the green card anymore because the incidence is quite low right now. So Korea is good in vaccination. As I'm a pediatrician, I know that it's one of the world's best. So I think we will easily pass the 40% of population and keep on. But as Professor Chung mentioned, the supply of the vaccine will be essential. And if we have a time to review the cluster outbreaks in Korea, I think our government can more target statistically to find out our weak points and adjust the quarantine measures based on these scientific facts.
Right, so adjustments need to be made as well. Meanwhile, as part of efforts to facilitate public inoculation efforts amid concerns over supplies and safety, some countries have chosen to allow the mixing and matching of COVID-19 vaccines. For more on this, I have Dr. Cristobal Belda at the Carlos III Health Institute live on the line over in Spain. Welcome to the program, Dr. Belda.
Okay, thank you very much. Good morning. Good morning here. Good evening for you.
Right, it's afternoon here, Dr. Belda. Dr. Belda, let's begin with the progress in the pace of COVID-19 vaccination over in Spain.
Okay, we have administered about 30 million of doses to the Spanish population here, and 1 out of 4 Spanish citizens has received the complete schedule. So in this regard, this has a huge impact on the evolution of the pandemic here. And now our incidence for 14 days per 100,000 people is under the threshold or 100 cases. So in this regard, I think that the combination of the natural evolution of a pandemic and the vaccination program has enormous impact in the situation we are facing. So we are seeing the light at the end of the tunnel.
Right, light at the end of the tunnel, which is why, Dr. Belda, starting this week, Spain has eased its entry restrictions to fully vaccinated travelers from across the globe. Now, speaking within your capacity as a medical professional yourself, Dr. Belda, how do you respond to this move?
Okay, I think that is the classical dilemma, is the classical debate between the economy and the public health. So in this regard, okay, we are facing a huge financial crisis in Spain and in Europe, probably all over the world, and we have to start to move the engine of the economy. Spain is a country that depends on tourism, and I think that the efforts in vaccination could be balanced with the economical efforts in order to help our country to go ahead. So in this regard, I'm really not worried about this situation. Obviously, we have to keep in mind that all the new variants could have a huge impact, but we need to live. We need to live.
Right, we do need to live, Dr. Belda. Now, let's touch upon the study by your institute on the efficacy of blending COVID-19 vaccines. Doctor, please tell us a bit about your findings and their implications.
Okay, first of all, we have to avoid the use of the term mix. For a mix, you have to be in the same place at the same time with the thing you are mixing. Okay, and keeping in mind the pharmacokinetics of both vaccines, there is no mixing. So this is a prime and boost. So that in this regard, we are using a classical strategy that has been developed for many years in other disease. And in this regard, what we have identified is a huge immune response. we are unable to compare the response of a mix and match schedule with the homologous classical schedules, obviously because we have not a control arm. Because in Spain, when we designed the clinical trial, the second dose of the Vaxzevria was not allowed to be administered to people under 60. So that's the only thing we could do was, okay, I have more than 2 million of people who would not receive the second dose of Vaxzevria. What is the best choice for them? To stop the vaccination program with a single dose, or to add a second dose using a different platform. So in this regard, we designed this clinical trial, and we concur that it's better for our population to receive the second dose of a different vaccine, keeping in mind that we are unable to identify any safety concern or a very rare, very strange clotting secondary effect that any clinical trial would be able to identify. So that this is the main conclusion for us.
I see. Dr. Belder, would it be okay if I use the word combine COVID-19 vaccines then instead of mix? Dr. Belder?
I'm sorry.
No, I was wondering, instead of the word mixing and matching, would it be okay if I use the word combining different COVID-19 platforms?
Okay. Combine. I think that combined would be better.
Okay. With his permission then, Professor Zhang, I ask you about how Korea is currently conducting its own trial of combining COVID-19 vaccines. What are your thoughts on this method of inoculation?
I think it's not a bad idea because, first of all, you can make the schedule very flexible. So you have one vaccine, then you have another choice, multiple choice of second vaccine as an alternative vaccine. So it's very good. And if I think about the benefit of cross injection or cross injection, then I can say you have two different vaccines with two different antigenicity. And one vaccine can make a bit different spike protein antigenicity. So you can cover wider antigenicity if you use both vaccines compared to one vaccine. So maybe it could be an additive effect, or some might think that it could be a synergistic effect by injecting crossly. But there should be some risks about that. There are not many studies on that, even though we have a Spanish study, German study, and our own study will be coming out sooner or later. But there is not many evidences on that. And maybe two different vaccines can induce two different allergic reactions. So the Pfizer vaccine have polyethylene glycol, which is very allergic. And AstraZeneca vaccine, for example, has a polysorbate, which is also very, very allergic. So you have a higher chance of getting anaphylactic or allergic by getting two vaccines. So nobody knows, but maybe as a clinician, I would suggest that cross-injection is not a bad idea.
I see. And Dr. Belder, here in Korea, COVID-19 inoculations using Janssen vaccines have begun on this Thursday for military personnel over the age of 30. What can you share with us about the use of Janssen vaccines in Spain?
Yeah, we are using this vaccine in Spain for a very short period of time because of the regulatory issues that every vaccine should cross. For the time being, we have not identified any risk different to that observed in clinical trials. Obviously, because of the vector that base the vaccine platform, we are looking for the thrombotic, the potential thrombotic events that has been described by many regulatory authorities. However, in this regard, the information that we have is very scarce because we started to use this vaccine a few weeks ago.
I see. All right, Dr. Belder, again, thank you for making the time to join us live at this very early hour with your thoughts.
Okay, thank you very much. Bye.
Right. Professor Kim, staying with Janssen vaccines, now the appeal seems to be that it is a single dose, but this appeal itself is also raising questions about its effectiveness. What are your thoughts on this?
The clinical trial done by Janssen vaccine, they included the age group more than 18, and they said it's effective 2 weeks after that one shot, and it tells that about 72% effectiveness for moderate COVID-19 and about 85% effective against severe COVID-19 infection. So it's somehow satisfactory. The price is about half of the Pfizer and about twice of the AstraZeneca. And they say there was no hospitalization due to COVID-19 4 weeks after the vaccination. So and it might also provide some protection against asymptomatic infections also. So it's very difficult to compare directly one-to-one with other vaccines because they have a different time period, and so I would say it's just as effective as other vaccines, and there's one advantage: you may have only one shot.
Right, you go through just once then. Professor Chung, what are your thoughts on talk about booster shots for those who receive the Janssen vaccines?
Yeah, as Professor Kim said, it is a very effective vaccine, Janssen, and it's effective for preventing deaths, hospitalization, and etc. But it is one of adenovirus vector vaccine, and all the other adenovirus vector vaccine is scheduled for 2 shots, not 1 shot. So in fact, the Janssen, the J&J, has already started second dose clinical trial already. Maybe in some months then we will see it is more highly effective than 1 shot or not. So I think maybe the second shot will be needed if you compare with the mRNA vaccine, which is highest efficacy so far. But until then, the one-shot vaccine is very effective, very useful, and particularly for people living in islands or very isolated area who need a vaccine very urgently before departing the country for a national purpose or etc. So Janssen, I think Janssen one-shot is still very effective, as effective as other 2-shot vaccines.
Right. Professor Kim, meanwhile, what are your words of advice with regard to taking painkillers post-inoculation?
Well, if you have a symptom like a pain or fever, that means that this vaccination is working and maybe some kind of immune buildup is happening inside your body. My wife was vaccinated yesterday, the first shot, and she went to the pharmacy to get some acetaminophen, and it was not easy to buy something. But anyway, she got it. Well, you can apply some cool packs on the injection site for easing the pain, and also you can exercise mildly on the injection arm, and you might have to keep yourself hydrated, and lastly you can take some medicines, just as I mentioned, some acetaminophen or ibuprofen or even aspirin. But it is not recommended to take this kind of medication before injection. And if the fever continues more than 3 days, I think you should visit your physician and check yourself.
Right, so you should be taking the painkillers after your vaccination, not prior.
Yep.
Professor Chung, vaccinations for those in their 40s and 30s will start at the beginning of the 3rd quarter. What ways do you propose to perhaps boost inoculation within this age group?
Well, that is the most important thing before we get the herd immunity, because people in their 40s and 50s, maybe in 30s, will not be agreeing too much about getting vaccination because they are healthy, they have no chronic diseases, and these days, current situation is very mild for COVID-19. It's not serious like other countries. But we need having said that, we need to propagate vaccination campaign. So maybe we need incentives for those people, like free passing to public facilities and etc. But if you look at the United States, they are giving a free beer, or they are having a lottery program and etc. But I like to emphasize that too much of enticement is not recommended, because it is against the medical ethics. So the enticement itself is not a very good idea. But the government need to give some rewards for fully vaccinated people, because they are very compliant and they wish to be healthy on their own, but they have got the vaccination for our country. So we need definitely a reward for that.
Right, that is true. All right, Professor Chung, as always, thank you very much for your insights. And Professor Kim, thank you very much for your words today.
Thank you.
Right, sporadic cluster infections persist nationwide amid the growing presence of variants. So do keep this reality in mind when seeking to venture outdoors. Thank you for watching.